Beyond IRCAD. Surgical Journeys.
Hello everyone and welcome. Welcome to Beyond IRCAD, the podcast where we dive deep into the lives and careers of successful surgeons from all around the world. Coming to you from Strasbourg, France, we have a very special guest in the studio today. He's the head of the neurosurgery department at Hôpital Lariboisière in Paris. With over 2 decades of experience, he's become a renowned authority in the world of surgery. He's displayed exceptional talent and a passion for pushing the boundaries of surgical knowledge. Professor Sébastien Froelich, thank you so much for being with us today.
Thank you very much for inviting me.
It's a pleasure.
It's a pleasure.
So welcome. And so to begin this podcast, we're going to talk about you. We're going to talk about your background and what made you the surgeon that you are today. So could you maybe start off by telling us about yourself, about where you're from, and how you became interested in the field of medicine and surgery?
I am originally from Strasbourg. I was not born here, but my family is from here, so I'm from Alsace. I did my medical school here in Strasbourg. I have to say that I am not one of those students who can say I always wanted to be a doctor. It came quite late. In fact, a few months before I decided to apply for medical school. I was not so convinced of doing medicine. But rapidly I found in medical school areas where I felt very comfortable with. It was quite natural, like anatomy, all the surgical rotation I made. I felt that it was a good environment for me. So that's it. And progressively during my medical school, I found that surgery was for me. And one of my last rotation, I went into neurosurgery. And I went one day in the OR, and I was shocked by what I saw, and I came back every day. And I have to say, I never left neurosurgery and the operating room.
So that's quite interesting, because you didn't know from an early stage that you were going to pursue a career in surgery. So what sparked your interest? What was there an event maybe, or maybe a person around you?
Not necessarily. I think I was like many young guys who don't necessarily, have a clear idea of what they want to do. But I went into it. I found something I liked, for which it was natural. It was not really work. It was just something I liked, and I was doing quite easily. Learning anatomy, interested with anatomy and some part of it. And then meeting fantastic people during my rotation. People who brought me with them in the OR and shared their passion. And it's not only what I saw in the OR that I liked. I remember this first day where I was in the OR. I still see the surgery I have seen on the screen, and it's images that are still in my head. And it was beautiful aneurysm surgery, but the atmosphere in the OR was quiet, a lot of concentration, silence, and the first minute of meeting someone or meeting a situation, I think, are extremely important.
Yeah.
And I felt very good in this environment.
And
then I decided to keep going. It was not easy. I mean, you need to work for the residency exam, but everything I did since then was to be one day at the place of the surgeon who was operated this specific day.
Okay, so when you looked at this surgeon, did you look up to him and think, this is what I want to do, this is what I want to become?
Absolutely. I said this. I would like one day to be able to do that, and to, this is exactly what I told myself.
Okay.
I was not I had no passion for medicine until this moment. The passion was born just at the specific day where I went into the OR.
That's incredible. So you didn't know you wanted to do that before? You went in the OR and then it just went naturally?
Yeah, then everything became natural. And I have to say, I never had the feeling of working, going to work. I have to wake up because I have to go to work, which is, I guess, something that a lot of people can experience because you don't always do what you want. But I have to say that I was extremely fortunate to find something where every day I go to work and I go where I want to go.
It's very fortunate. It's a passion.
It's a passion, yeah, I have to say it's a passion. It's a chance.
Yes.
It's an incredible chance.
And so when you were sure that was what you wanted to do, what was the reaction around you, your friends and family? Were they supportive of that choice?
Yes, absolutely.
Yeah,
they were very supportive. They were happy for me that, when you're young, you find a place where you enjoy to be. And and I have to say, I worked a lot. I dedicated a lot. It's also sacrifice for other things, but I never felt it as a sacrifice.
Yeah,
I always felt it as something natural. Sometimes it's too natural and you have to fight a little bit against this because there is a world around you and you have to pay attention also to other things and people.
We'll be talking about that as well. And so what sparked your interest in the brain in particular?
Well, quite rapidly I was interested with complex intracranial surgery, and here also I was extremely fortunate to do my first rotation in a department of neurosurgery in Colmar. But for a neurosurgery resident, it was good fortune because Colmar at that time was extremely strong as a department. And there was a skull-base surgeon, very famous skull-base surgeon, Vinko Dolank, who was coming in this department every month. He was a chair in Ljubljana, but extremely known neurosurgeon around the world. And he was coming for 3-4 days doing extremely complex cases. I didn't have a clue of what I was looking at because it was my first rotation, but it was extremely impressive. Everybody was watching him like he was doing, incredible thing, and that's what he was doing. So it gave me a taste of it, and I said, again, I would like to do what he's doing. I started to dream.
Yes.
I mean, this neurosurgeon made me dream of what I could become.
Of course. So you're talking about Vinko de Lang. Were there any other surgeons that you looked up to, and thought, this is what I want to achieve?
Yes. I mean, I really had the good fortune to meet with fantastic guys. The resident working with me was Didier Scavarda. He was older than me. He's now the chair of pediatric neurosurgery in Marseille. Fantastic person as a mentor. Yes. He was finishing his residency. I was very young, and he took me on his shoulder to give me the direction. He was tough, but I was also very fortunate to meet him. So it's not necessarily meeting someone who is already at the top level, but someone who is generous enough to give you direction. I mean, I met a lot of fantastic people, and this was also my good fortune.
And then you went to the United States, is that correct?
Yes. After this experience in Colmar, I moved to Strasbourg. I met again the neurosurgeon I have seen in the OR. My very first time I went in an OR to see neurosurgery, and we had a very strong relationship since then. But I came with already this image in mind of Vincodolanc in Colmar. Strasbourg was not a place where skull-base surgery was at this level. So rapidly I said I have to go to where I can see that, where it's happening, where there is a school, where there is dedicated strategies. So I wanted to go to the US.
The Mayfield Clinic?
The Mayfield Clinic. I applied in multiple centers in the US. And one thing I remember is that the person from Cincinnati who answered to my application was Harry Van Loveren, fantastic surgeon. And what I liked in the response he sent me is that we will be happy to work with you.
Yes.
And the with you, I said, this is something interesting. This is something special.
Yeah.
It was not me working for them. It was working together. And it's exactly what's happened. I went in Cincinnati and I worked in the lab, but it was really a collaboration. They gave me everything I needed to express my passion. And this is what I did. I worked a lot, but it was not really work. It was just enjoying and taking advantage of your passion.
So that's for your fellowship.
That was my first year of fellowship. And then I discussed with the team there, and they offered me to come back. But for a clinical fellowship, you need to have USMLE, which is a kind of American diploma for doctors. So I had to take the exam for this to be able to practice surgery. So it took me a while because doing it while I was already a young faculty, which is in neurosurgery quite demanding, I had to find time to come back to medical school, learn again the basics, take the exam. So it took me 3-4 years to take all the exam, and then I came back as a clinical fellow, which was also a unique experience.
And so all these years in the US, when you came back to France, did you notice any differences between the US and France in terms of technological advancements, for example, or even just the way that surgeries were performed?
The difference coming back to Strasbourg, I would say, was volume. Where I was in Cincinnati, there was really a dedicated team doing only skull base. So surgeons in the US have a tendency to be subspecialized, especially in academic places. And Cincinnati at the time was a big center because in the middle of 3 states, so huge population to treat. Compared to a department in Strasbourg where there was not true subspecialization. You had surgeons more into cranial, more into spine, but everybody was doing everything. And so this was the main difference. But other than this, I have to say that the people who trained me in Strasbourg were fantastic surgeons and remained a fantastic surgeon when I came back from the US. It's good also to have a knowledge in everything. And that's also a strength. It was a strength when I moved to Paris because having an experience in many surgical fields give you confidence, to mentor younger people. But definitely the US at that time offered this subspecialization, a kind of philosophy in skull-base surgery, which was not very common in France at that time.
Okay. You were talking about your own mentors, and you have become a mentor yourself. You come here to IRCAD for the courses. How long have you been coming for the courses now?
Almost 15 years, yeah. Yes, almost 15 years.
And so how did that happen? Did you were you invited to participate?
No, I have to say that when I was in the US, I had the opportunity to go in many courses. On the first course I went, on the first course I did a demonstration, I was a resident. So I was a resident doing a demonstration to experienced neurosurgeon. So it was unbelievable for me. But this is the opportunity that those people gave me. You know, it's an incredible gift for a young neurosurgeon like me. I was like a kid in neurosurgery. But Harry van Laveren, Jeffrey Keller, Kelly Disease, those people means a lot to me because they gave me this opportunity to express myself even at a very young age. So I wanted to pay back because what they gave me was amazing. So when I came back in France, I said I have to organize a course to be able to invite those mentors I had for them to share with the people here in Europe, in France. So I tried to find a place to organize a course and to organize a course at the level of what I had, what was given to me when I was in the US. So I came to see Professor Maresco, and I have to say that another person who is extremely important in my career is Professor Maresco, because he gave me this opportunity to pay back and to move to the next level. And the IRCAD, it's exactly that. It's the opportunity to share with others at a very high level in a fantastic environment. And yes, I took advantage of it. But again, it was a gift given by someone. And Professor Maresco is the one who gave me this gift here in France.
So opportunities were given to you, and now you're passing on knowledge to the younger generation.
I'm trying.
And so is it something that's also important to you to learn every time you come here as well? Because you teach to the course participants, but I guess you keep learning as well every time you come here.
Absolutely. For me, it's working in a department in your world. It's a kind of closed environment in Paris. I have a fantastic team and it's great, but still it's a closed environment. So being able to come here, interact with others, teach, do some demonstration is a fantastic opportunity for me to learn, to question myself, to pick up ideas, to apply those ideas directly. And the young guys who come with me, the research fellow I have, the clinical fellow, it's a driving force because they are pushing behind constantly. So they force you to move on, to move forward. So yes, all this is a driving force for me.
Are there times when you disagree with other experts?
Yes, absolutely. I quite often, in fact, and they disagree with me, but that's the exchange. The value of sharing is sometimes to say, well, it's probably a good way to do it, and you change and you adjust a little bit, and even if you don't agree, you still have it in mind, this opposite opinion, and it can influence the way you think next. So yes, I think this constant interaction that those IRCAD course provided me was extremely important in the evolution of my career, evolution of my practice, evolution of the way I interact with others, network. Absolutely, it was fundamental.
So is it important to be able to question yourself, to maintain that scientific mindset?
Yes, absolutely. And when you teach, people are watching you. They are listening to you. So it's important to constantly question what you teach.
Do you also need to have, as a surgeon, good communication skills? Like, for example, when you have to deal with a patient, rather than just focusing on the medical duties, do you also find it important to exchange with your patient, to explain the procedure and what's going to happen and so on? Is that an important aspect?
Absolutely. I would say it's the most important aspect, is the relationship with the patient. It's not necessarily something you put at the top of your list when you're young, but the more with the years, over the years, the relationship with the patient is definitely became the most important, because what we do is complex surgery, and the most incredible people I have met in my career are some of my patients. I mean, the way they face those situations, the trust they have in you, it's something you just can be humble with this. So this relationship with the patient, yes, it's extremely important. It's our daily practice. I mean, here it's a week in our agenda, but the patient, it's every day.
Of course. And have you had like specific cases where it reaffirmed your passion for your profession?
Yes, I mean, I am fortunate enough to have a practice where every day is another day. And the type of surgery we do is quite challenging case. So it's never the same case than the day before or the week before. So every day it's an opportunity to learn, to explore new situation, find new solutions to new challenges. So this is also the beauty of skull-base surgery, because it's you always can find a way to improve, and you have always to try to improve, because definitely it's a risky surgery, and there is consequences, and so that's also the beauty of it, that it's constantly
changing,
remaining challenge.
Yeah. Do you feel pressure when you step into the operating room?
Not so much, in fact. That's being afraid of what I will do today is not something I experience. I'm not afraid. And I think it's important not to be afraid. If you're afraid of this coming surgery, it means that either you're not prepared enough, or I'm not sure it's a good state of mind. But it depends of your own personality. Maybe for some people it's necessary. How can I say that? It doesn't mean that I am sure of myself. Okay, I have a lot of doubt, and until the last moment, I think about the strategies, options until the very last moment. So I'm not sure of myself. I have a lot of doubt of how we will do the case. But once I am in, it's not a feeling. I don't experience a feeling of being afraid, or no. This is not exactly like this.
Do you ever get cases where you're just stuck and you're not sure what to do? Does that ever happen to you? Or you always find a way?
No, I had cases where I stepped back and
okay.
I decided now it's time to stop. And it's something you always have to keep in mind in skull-base surgery. I remember Harry van Loveren telling me that, sometimes mentors tell you something and you hear it and you keep it in mind. He told me skull-base surgery, or surgery in general, it's not a fight to resect a tumor. It's a fight for the patient. So resecting a lesion or treating a pathology without considering the patient around and the consequences for the patient is easy. But we should not forget that patient is asleep, but patient will wake up, and the most important is how he will wake up, how he will live his life after the surgery. So yes, sometimes I step back, and it happened to me also to step back before the operation, because I feel that no, there is something wrong. I'm not ready for it. The decision is not clear. Something is wrong. We stop. I cancel the case. Not very often, but it's always better to stop, even last minute, than doing a case where you're not prepared, the strategy is not clear, something is missing. That's definitely something, and related to your question before, that's why I think I'm not afraid, because when I do it, it means that I'm sure it's a good thing to do.
Okay. So
I don't remember of cases where I was, you're entering the room and you're not completely sure. No, this is not something I experienced.
are there any, because the brain is very mysterious, how much do we really know about the brain?
Not much. In fact, it's still a mystery for the vast majority of the brain and the brain function. Obviously, I know some things about the brain, but as a skull-based surgeon, the only thing that we need to have in mind is that the brain should be protected. So we should preserve the brain, because most of the lesions I'm treating are not into the brain. It's below the brain, in front of the brain. And the difficulties is to have access to those lesions without injuring the brain, or what is coming out from the brain or going in, which means cranial nerve or vessels. Sometimes I work into the brain. Obviously, you need to know where you are into the brain and to know the function of the brain for that. I have a partner, Emmanuel Mandonnet, he's working on brain tumors. So he's doing sleep-awake surgery. So for him, he explores the brain function while he's operating. Me, I am turning around the brain. So it's different aspect of neurosurgery.
Okay. Have you been involved in research? Maybe you still are. Is that an important aspect as well?
Absolutely. It's a very important aspect of academic department of neurosurgery, and we have different area of research. In fact, in my department, everyone has a specific focus in terms of research. Yes, it's mandatory for what we do, to try to improve what we do, and to use clinical data to get better, to, biological tissues from rare tumor need to be used to find new options. The surgery I do for some tumors, such as chordoma, for example, extremely complex but rare tumors. Surgery is an option now, radiation therapy is an option, but it doesn't always offer a cure. I think the cure will come next, with a better understanding of the tumor itself, finding new treatments, medical treatments, targeted therapy. This will be the solution for cure. Surgery is a great tool, but most often for those tumors, it doesn't provide cure. Cure will come from research, basic research, and we have program for those specific tumors in basic research. Also epidemiological studies on meningioma, relationship between hormones and meningioma, and others programs.
So research and surgery go hand in hand.
Absolutely. Absolutely.
So you said every day is different for you, but if you had like a typical day, what would a typical day be like for you at work?
It's a busy day.
Yeah, I'm sure it is.
It's a busy day from the early morning to late in the evening. It's a day where you
intense.
You're intense, absolutely intense. The condition now in France, in the hospital, is not optimum. We face some difficulties. And it add a little bit to the fight, but I always believe that working in an hospital, working with patients should not be too easy, because part of the difficulties we have on a daily practice to get things as a doctor for our patient is a fight, but at the end it's also a fight for the patient. So you get the spirit of this fight also because you need to fight to get the things. If everything is given to you too easily, then it changes also the human relationship I think we need to have with the patient, fighting for them. So I knew some places in the US, sometimes you have places where everything is easy for the doctor. It's good, on a daily basis, but something is maybe missing. And that's why also I like the French system.
It's a bit more challenge.
Yes, I mean, I don't think a place where we treat people should be too easy for the doctors, because then what the patient is facing, which is difficult things to fight against the disease, sometimes deadly disease, there is a disconnection between what the patient feel and what the doctors feel. Mm-hmm. If it's too easy for the doctors and very tough for the patient, then there is a kind of disconnection.
Yes.
Still, we need good condition to work, and this could be part of the difficulties in hospital in the future. But I mean, that's.
But it's true that because the stakes are very high, we are talking about life and death. It has to be demanding, hasn't it? And
yeah,
is that the state of mind you come here with at IRCAD when you teach, for example? It has to be demanding. You have to have a certain standard, to pass on the knowledge. And do you sometimes see some course participants and think, he's really cut out for the job. He's going to be an amazing, some quick learners, fast learners.
Yes, I see that.
Yeah,
I see people with talents. They have something different.
Yeah,
absolutely, and I feel this quite rapidly.
Okay.
Not everybody has the same investment in what they are doing, but not everybody need to have this level of investment. We don't need only a surgeon dedicated to one thing. We need to treat a wide broad of pathology. Some are very simple, and you don't necessarily need the same amount of investment in the technique. So, there is rooms for everyone and every level of dedication. What's important is to do your job with passion, to be dedicated to the patient himself. But then the level of investment depends also on your need in life, and I would say having some balance also is helpful to treat patient.
And how do you keep that balance?
Well, it's not so easy. Sometimes I feel I should be more balanced. I'm not the only one to feel it.
Yeah.
The people around you may suffer also of this dedication. So yeah, it's you have to sometimes to step back for this reason also.
So what would you do to be able to maintain that balance between your professional life and your personal life?
Well, it's you need to find someone who share also a passion. This is the best, and it's the case for me. So different passion, but we share passion for what we do. It's extremely important. But then, yes, it's a constant effort to sometimes give a little less to the work and a little more to outside of work.
Yeah.
But the passion, it's tough to fight.
Of course.
Against your passion.
Yeah, because you're so passionate, of course.
Yeah.
Do you ever manage to completely switch off? Or is that something that's quite challenging?
No, but I have the feeling that at some point the priority need to change with age, with advancing in age. My passion for the operating room probably at some point will have to step back a little bit for other things like teaching, training, research. It has to change with time, definitely.
Yeah.
And it's good. It's good.
Yeah, it's positive. And so you travel a lot for your job.
Yes.
Do you manage to make the most out of those travels as well? Do you get to take some time off and visit places as well?
Yes,
more or less.
Not so much. But yeah. traveling around for my job is also a relief from my daily practice, because sometimes you need to take some oxygen outside.
Yeah.
And also to pick up ideas, interaction with others. I think it's important to move away from your place find new things, bring it back. That's what I tell to the one coming after me. I want sometimes to kick them out of the house. Go and find your own way and find things you will bring back to the department, but also bring back to me.
Yes.
Because
so when you move around, does that offer you a different perspective?
Yes.
Yeah. On the way you perform the surgeries as well, or?
Yes, on the way you perform the surgery and the way neurosurgery is practiced in other places. And in France, we have a tendency to complain. I mean, it's part of our tradition.
It's a cultural thing.
Yes, but when you go away, you see that, in fact, it's not bad in France. We have quite a unique setting. We are free to make decisions. It's a very nice environment. I think we are very fortunate of what we have. It could be better, definitely. It's the same. We need to try to improve. But still, when you go in other places, in French we say l'herbe n'est pas toujours plus verte ailleurs. I don't know how to translate that in English.
The grass isn't always greener on the other side.
Absolutely. And I think in France, in Europe, we have a fantastic environment and free environment to improve. Yes. So that's also what you learn when you go around.
Are there any particular projects that you're excited about?
Yes. I mean, technology is something we have to focus on. Definitely in neurosurgery, this is something I am excited with. How robotics could help neurosurgeon, my practice. Augmented reality is something rising, and all those fields. Yes, this is where we try now to start research program because neurosurgery is extremely small environment, extremely complex surgery. So it will probably one of the last field where we will have robots coming helping us, because it's very tiny environment and variable movements. But I think it's time now that we bring those technology into our field, because we need it. We need to have more secure surgery. The morbidity remain too high in surgery in general. And if we want surgery to survive, and it has to survive because it's still the best treatment for a lot of pathology, including cancer, but it needs to be more safe, and especially in neurosurgery. So this technology, I think, will help us in the future, and we have to bring it more in our field.
So obviously robotics will become more and more important, I think, in all fields of surgery. Is it still important to know the fundamentals, though, without the robots?
Yes.
It's a double-edged sword, isn't it?
Yes, I think it's important to know the anatomy, for example. It will not be replaced by neuronavigation or augmented reality. You still need to know the map behind all this. But yes, we need to bring support for the surgeon during the operation, support for the map, support for the technique movement, for the movement of the surgeon, monitoring, repair. All this is, I think, is the next step.
If you could be in a room with your younger self, with Sébastien Froelich at 20 or 25, what would you tell him?
I keep going.
Keep going. And what's the best piece of advice you could give to our young listeners today?
Follow your passion. Follow your passion. And try to find a passion and follow it. That's... I had the fortune to find a passion and to have people around me helping me to follow this passion. And this was my good fortune. That's
great advice. Thank you very much, Professor Sébastien Froelich. Thank you for being with us today. Stay tuned for more episodes, guys. We've got some more content coming on Beyond IRCAD. Thanks to all the listeners worldwide, and see you guys next time. Thank you.